Hi, Dr. Frank Johnson from Sport Medicine Ultrasound Canada. I'm going to show you how to scan the lateral hip, specifically for the tendon of the gluteus medius and the greater trochanteric bursa. So the patient position is side lying, facing away from you, looking at the ultrasound machine, same as you are. The landmark is going to be your femur, quite distal where it's quite circular in cross-section. The orientation of the probe is going to be short axis on the femur, and the movements of the probe are going to be proximally until the pointy aspect of the greater trochanter comes into view. Now there's a bony landmark that's important, and that's the pointiest bit of this otherwise pointy bit of the greater trochanter. And the pointiest bit is going to demarcate the anterior facet of the greater trochanter from the lateral facet. The gluteus medius tendon sits on the lateral facet here. So that's how you scan for the gluteus medius tendon. Now the greater trochanteric bursa sits between the gluteus maximus and the gluteus medius, somewhere up here, but then continues around this way, continuing to lie directly on the posterior facet. So if we're going to scan for the greater trochanteric bursa, we can continue coming around the corner until we see the greater trochanter come to an end, and then we know the posterior facet lies between the edge of the lateral facet and the edge of the greater trochanter itself. And here lies a very clear way to reach or inject the greater trochanteric bursa. I'm going to show you how to scan and inject the greater trochanteric bursa. First thing to know is the greater trochanteric bursa is also called the subgluteus maximus bursa. They're essentially the same thing. We like to find it at the posterior facet of the greater trochanter. Patient position is side lying away from me. My landmark is going to be the proximal femur. My orientation of the probe is going to be short axis on the femur. I'm now going to slide the probe proximally towards the greater trochanter, keeping the femur nice and bright in view. I now see a very bright portion of the greater trochanter. This is what we call the pointiest bit of the greater trochanter. And specifically what I'm looking for, I'll now point out with the yellow arrow. I'm actually looking for the pointiest bit of this otherwise pointy structure. I'm going to slide and overscan a bit to make sure there isn't anything else that's really, really pointy. Now I've gone past that pointiest bit. I come back onto it. This now demarcates the position of the anterior facet of the greater trochanter, the lateral facet to the greater trochanter, and my final movement is going to be the following. I slide around to the posterior facet of the greater trochanter like so. In the center of the yellow arrow now is my gluteus maximus muscle, and the white bone there is the greater trochanter, and once again the posterior facet. I'll often do the injection with the needle entry here in plane, going down to touch where that yellow arrow tip is. Other practitioners may prefer to come out of plane with the needle entry angle like so, straight down to bone. That's how I find the greater trochanteric bursa. I'll now continue on to show you the gluteus medius tendon in the event that you want to inject that with either cortisone or PRP. We go back to our home position of the pointiest bit of the greater trochanter, and we know that the lateral facet to the greater trochanter is where the tendons of the gluteus medius attach. To inject these, once again, I can either place my needle entry point here, or I can come directly out of plane, straight down and touch the tendons there, right down to where that yellow arrow tip is. And so that's how I inject the tendon of the gluteus medius.